Hi, my name is Lakeisha, and today I'm going to be doing a mini bag method for my secondary line. So first what I need to do is verify doctor's orders. I'm going to make sure I have the correct medication, the dose, the route, the frequency, and then also I'm going to check the patient's lab results, and I'm also going to be checking for any history, any history of any allergies. Okay, so next what I'm going to do, I'm going to be reviewing my information on my medication. Alright, so the doctor has ordered 12.5 milligrams via IV every 6 hours PRN. The action of this medication is to block effects of histamine as inhibiting effects on the chemoreceptor trigger zone in the medulla and resulting in an antiemetic property. The purpose of this medication is for nausea and vomiting. The dose is 12.5 via IV every 6 hours PRN. The side effects include confusion, dizziness, and disorientation. The contraindications are hypersensitivity, comatose, bladder neck obstruction. The nursing implications are assess for nausea and vomiting before administering medication, monitor for blood pressure, pulse, and respiratory rate. Also, you need to monitor for EPS symptoms and eyes and nose, intake and output. And the infusion time is for 15 minutes. So now I'm going to be doing my dosage calc. The doctor has ordered 12.5 milligrams. And in my bottle, this bottle states that I have 25 milligrams per ml. So the order is for 12.5. So I'm going to be administer 0.5 mLs of Finnegan. And I check my expiration date and my lot number. Alrighty. So now I'm going to be doing for the IV, the fluids. I have a 50 ml bag. The infusion time is for 15 minutes. And then my tubing is 10 drops is the 10 drop factor, which equals 33 drops per minute. Alright, so now I'm ready to drop my medication. Zero 0.5. Now I'm going to place it into my IV fluids. And I'm going to place this in the shots container. I'm going to shake up my medication. Now I'm ready to label my medication. I'm going to put Finnegan, the dose, 12.5, the time, the date, my initial. Alrighty. Place that here. Now I'm going to prepare my tubing. Alrighty, so now I'm going to label my tubing. And I'm going to label my tubing with my initial, time, and the date. Let me go ahead and prepare my line. Good. Alrighty. So mine is ready. Close this back off. And if that didn't fall, I will place it back on the top and it will be sterile. Alrighty. So now I'm ready to go in the patient's room. So I'm going to pick it up, but it will be sterile. If this fell on the ground, I will get a new tubing. Alright. So now I'm ready to go in the patient's room. I have my Mars. I gathered my Mars and all my equipment. So now I'm ready to go in the patient's room. Hi, my name is Lakeisha. I'll be your student nurse today. Can you verify your name and date of birth? Okay, good. Patient stated name and date of birth. That's on the band. Alright. So today the doctor has ordered some Finnegan. Are you currently having any nausea or vomiting? Okay, good. So this medication should help you with that feeling, okay? So first I'm gonna go ahead. Oh, do you have any allergies to any medications? Latex, iodine, shellfish? Okay, good. So now I need to wash my hands, apply my gloves. All right, so I'm gonna be looking at the IV site to make sure there's no phlebitis or infiltration. I'm gonna check for any pain, tenderness, swelling, redness, or any leaking. And there's none present. All right, and I'm going to assume that the line is still pitting. All right, so now I'm going to lower my primary. And I'll hang my secondary. All right. So now I'm going to clean up the port. I'm going to cut off the primary. Push this on. And then turn on my secondary. And this clip will be on already, assuming that the primary is already running. Okay, good. Now I'm going to establish my drop rate, and it should be 33 drops per minute. Okay, good. So after I establish that, I'm going to check for any swelling, any pain or tenderness. All right, so I'm going to remove my gloves and wash my hands. So now I've been observing the IV line for 30 minutes, and I'm going to come back into my patient's room. Next, what I'm going to do is go ahead and shut off, and I will wash my hands and place new gloves on, and I will shut off the secondary line. Good. Turn on the primary line. Remove. Place my alligator clamp for next administration. Bring up the primary line. And establish the rate per doctor's order. Okay, good. Again, I'm going to check for any swelling, infiltration, or phlebitis, any pain or tenderness, which with new gloves. Patient is doing well. All right. So before I leave, I need to check my 4 Ps, make sure patient is in a good position. See if they need to use the restroom, check for any pain, and if they have their personal belongings. And again, to call me if you're having any swelling, any leaking, or any pain in the arm. So next, I remove my gloves, wash my hands, and now I'm ready for documentation. I will document in my MAR. I'm going to document the date, the time, the route, and the dose. Next, I'll also state my current IV site of the condition. Next, I would go ahead and record the fluids that was in the fluid volume that was administered for my secondary, and then I'll also record any the eyes and nose intake and output. And then that's the end of my secondary piggyback.